In the previous episode, we looked at some basic concepts of venoms and poisons. In this video, we will focus specifically on antivenoms and see how some people use unscientific treatments for snake bites, and in particular, how their techniques appear to work. We will also look at the right scientific way to treat a snake bite. The fangs are waiting. Snake antivenom is a medication made up of antibodies used to treat snake bites by venomous snakes. It is a biological product that typically consists of venom neutralizing antibodies derived from a host animal, such as a horse or a sheep. The host animal is injected with non-lethal doses of one or more venoms to produce a neutralizing antibody response. Then, at certain intervals, the blood from the donor animal is collected and neutralizing antibodies are purified from the blood to produce an antivenom. There are around 3,000 species of snakes present across the globe, where only 20% or 600 species are venomous, and only about 7%, that is about 200 species of snakes, are able to kill a human. This is the primary reason why fraud healers get away and survive in our country. Even today, there are people who have different theories in what should do if a snake bites, like calling back the snake which bit you. Note that snakes have no visible ear, so they don't hear sounds as we do. They have vestiges of the apparatus for hearing inside their heads, and that setup is attached to their jaw bones, so they feel vibrations very well and may hear low frequency airborne sounds. So calling the snake back and letting it bite so that the injected venom is sucked back will not work. Some others cut open in and around the area where the snake had bitten, causing more bleeding. Some even try to suck the venom out using their own mouth. If you have any small cuts in your mouth, the venom could enter your bloodstream too. Tying a rope or cloth hard near the bite. This often causes the blood vessels to be constricted so much so that the blood flow to the area below the tourniquet comes to a stop, leading to a loss of limb. Some give alcohol, yes, probably for a little more courage, by not allowing the patient to sleep. Sleep is most often caused due to the neurotoxins taking effect, which leads to droopy eyelids. The unscientific medicine men and women who are unaware of this fact advise otherwise. Other traditional unscientific methods include a snake stone, also known as a viper stone, snake's pearl, black stone, serpent stone, or nagamani, is an animal bone or stone used as folk medicine for snake bites in Africa, South America, India, and Asia. The World Health Organization is very clear in stating that it has no effect on snake bites, bearing in mind that most snake bites are from non-venomous snakes. They state that traditional medicines and other treatments such as wound incision or excision, suction, or application of black stones should be avoided. Rattlesnake bites may be treated by killing a chicken and wrapping the warm body around the bite to draw poison out. More precisely, cut open the chicken's anus and put this around the snake bite so that it sucks out the venom. Does it really suck out? We leave the answer to the viewer's common sense to decide. 3 persons are made to chew drugs like dry ginger and few other leaves, and then blow the air from their mouths at the ears and vertex of the patient 150 times. Yet another method is making the person sweat excessively. Somehow the venom will go out through the sweat. Now let's take a look at the big four and some stats. Indian cobra. The Indian cobra is a moderately venomous species but has a rapidly acting venom. Though it is responsible for many bites, only a small percentage are fatal if proper medical treatment and antivenom are given. The mortality rate for untreated bite victims can vary from case to case depending upon the quantity of venom delivered and by the individual involved. According to one study, with 1,224 bite cases, the mortality rate was only 6.5%. Estimated fatalities as a result of this species is approximately 15,000 per year, but they are responsible for an estimated 1 lakh to 1,50,000 non-fatal bites per year. Common krait. The common krait is often considered to be the most dangerous snake species in India. Its venom consists of mostly powerful neurotoxins which induce muscle paralysis. Due to the fact that krait venom contains many presynaptic neurotoxins, patients bitten will often not respond to antivenom because once paralysis has developed, it is not reversible. This species causes an estimated 10,000 fatalities per year in India alone. There is a 70 to 80% mortality rate in cases where poor or ineffective treatment are given. Russell's viper. Russell's viper produces one of the most excruciatingly painful bites of all venomous snakes. Internal bleeding is common. Bruising, blistering, and necrosis may appear relatively quickly as well. This species is responsible for more human fatalities in India than any other snake species, causing an estimated 25,000 fatalities annually. The saw-scaled viper is small, but its unpredictability, aggressive temper, and lethal venom potency makes it very dangerous. This species is one of the fastest striking snakes in the world, and mortality rates for those bitten are very high. In India alone, the saw-scaled viper is responsible for an estimated 5,000 human fatalities annually. So as you can see, the issue most often is that people not getting the right treatment during the golden hour, which is the time when there is an urgent need for the care of trauma patients or patients who have suffered a snake bite. This term implies that morbidity and mortality are affected if care is not instituted within the first hour after injury. We really want to emphasize the fact that the only proven and scientifically accepted cure for snake venom is antivenom, or more accurately, polyvalent snake antivenom. So, how do the fake medicine practitioners make a living by fooling uneducated and unsuspecting people? To understand this, you need to clearly understand the fatality rates of snakes. First of all, many of the cases which are brought in front of the traditional healers may not be snake bites. Just because you thought that something bit you does not mean it was necessarily a snake, and patients in such cases recover after a while after the initial trauma phase passes. In the event of an actual snake bite too, in 80% of the cases, the people recover themselves as the body is able to make the antivenoms themselves. It may take some time for our bodies to do that, but our human bodies ultimately do create the antibodies themselves. This time is utilized by the fake healers who do their hocus pocus trying to claim credit for their magic. Furthermore, only 20% of the snakes are venomous, and among that, only about 7% are able to kill a human. Add this to the high number of dry bites that snakes often manage to give, which is where the bite is not strong enough to inject the poison, or the high number of times the snake is unable to inject a sufficient quantity of venom as it may have used up its venom recently on another prey. So there are a lot of factors that reduce the chances of a person getting a fatal bite. This is utilized by the so-called snake healers. Imagine if you take 100 snake bitten victims to those fake healers, 80 of them would go back healthy and cured without them doing anything. This makes the fraud a hero. No fake healers can cure a snake bite. They just take credit for what our bodies have managed to attain through evolution. If they are unable to save a person, they can easily give an excuse saying that you brought the patient late or you didn't follow the right procedure, etc. If they manage to get the person to survive with no help from their side, they claim this as their victory. This news gets spread and leads to such treatments being continued. Now, are all such snake healers fraudsters? As with any fraud or pseudoscience, many of them are doing it without realizing they are faking it. They firmly believe that they have supernatural powers as they are able to cure a majority of the people brought before them. They don't realize or understand the real science behind why they really get cured. So they falsely believe they have powers. But there is a lot of people who do this to fake people into believing they have the powers. Having said that, an estimated 1.2 million people have died from snake bites in India in the past 20 years, and a majority of these cases would be because our affinity towards these unscientific traditional treatments which has led to them not receiving the antivenom on time. So what are the right things to do in case of a snake bite? 1. Call an ambulance immediately. You should treat any snake bite as an emergency, regardless of whether you think the snake was venomous or not. Washing the wound with soap and water and holding the limb still is recommended. 2. Don't panic and don't move. While it is easier said than done, staying calm and still after a snake bite can help slow down the spread of venom in your body. If you have been bitten by a poisonous snake, not moving might save your life. It is a myth that snake venom gets straight into your bloodstream after a bite. Instead, it moves through your lymphatic system. Lymph is a fluid in your body that contains white blood cells. Unlike blood, which is pumped around your body continuously, your lymph moves when you move your limbs. If you can stay still and calm, you can prevent the venom in your lymph traveling further into your body. Number 3, leave the snake alone. Don't try to identify, catch, injure, or kill the snake. You are most likely to come off second best. At the hospital, staff have access to a range of tests that can help them determine the likely snake which you have been bitten by, thus enabling them to give you the most appropriate treatment. 4. Applying a pressure immobilization bandage and splint. Most snake bites occur on a limb, so legs, feet, arms and hands are the most commonly affected. If you have been bitten on a limb, applying a pressure immobilization bandage can stop the venom moving through your lymphatic system. But please make sure that it is not too tight and you can easily slide a finger beneath the bandage or cloth. A tight bandage or cloth around the bite may stop blood flow to the other parts, causing more damage to that part. Many deaths post snake bites occur due to the fear rather than the venom. So if you are near the person who received the bite, keep calming and reassuring the person. So our final verdict. We want to conclude this video with a message. Snakes are lovely creatures which don't deserve this fear and hatred. Snakes are most likely to bite only when they feel threatened, are startled or provoked, or when they have been cornered. And they approach residential areas only when attracted by prey such as rodents. Our sincere request is to not link spirituality with snakes and spread stories like snakes have memory and they seek revenge, etc. Also, in the case of a snake bite, seek medical attention immediately by visiting the nearest hospital, avoiding any other unscientific methods and delaying the treatment and wasting valuable time, which is called the golden hour in medical parlance. If you like this video, please subscribe and share with others. Until next time, it's bye-bye from Pale Blue Thoughts